introducing the panel, I would like to invite Mr. Ananth Narayan on the stage. Ananth, of course, all of us are aware, is the co-founder and CEO of Midlife. I would also like to invite Mr. Prashant Tandon, who is the co-founder and CEO of 1MG. And of course, would like to invite Anil. So Anil will be moderating the session. So thank you so much for your time.
And thanks, Ananth and Prashant, for joining in for the report release. So it's an honor to be part of this panel. So to begin with, of course, we can talk about a lot of things. It's a very fast evolving industry, and of course, you both are leaders in the industry. So I'm sure there are a lot of plans in the way you're growing your respective companies, and you see eHealth coming up. To begin with, maybe Ananth, if I can start with you. Healthcare in general, and as Abhishek just spoke about, it is at a tipping point in India, right? The government's focus, people's overall spending power on healthcare, awareness, and as well as, unfortunately, the lifestyle diseases which are rising up in India. All of these coming up together, it's completely changing the taxonomy of the Indian healthcare ecosystem. And healthcare in India is probably very different from what you would see in China or some of the other developed countries. How would you define healthcare in India, and what does it mean? How will it evolve? So it's an open-ended question, but your view on the healthcare in India.
Sure. Firstly, by the way, I think great report. So congratulations.
Thank you.
I think maybe just two thoughts. One is I actually looked at healthcare as an industry for almost 5-6 months before I actually joined. So before I got on to Midlife. And so if I think about what is unique and what's changing, I think there are 2 or 3 things that are interesting. First, healthcare is not consumer oriented, right? I think there is a patient, there is an influencer, and then there is a provider, right? The influencer is usually a doctor, somebody who gives advice, etc. And actually, the consumer is not at the center, right? So that's one big thing. It's $100 billion plus market where you don't have a lot of consumer orientation, right? The second is typically technology has actually played a role more in terms of continuous monitoring, more in terms of IoT and devices and all of that in healthcare, if you think about technology, as opposed to consumer technology and using data to actually serve the needs of the patients better. So there's no consumer orientation, very little technology orientation. It's a $120 billion market. I think the macro trends, I won't go much more into, you spoke about it,
Sure.
Chronic diseases, etc. Now, what's changed, I think, is you now have lots and lots of content available, and you have lots of people who have access to the content because of their mobile phones, but not necessarily access to healthcare, right? And therefore, their ability to use technology, because they're familiar with e-commerce, because they're familiar with the internet, their ability to use technology to actually then get their products and services is one big shift that I see, right? You talked about 110 million customers. The consumer journey for when a customer consumes content to when they buy a product, at least in the Myntra Flipkart days, used to be 24 months. That number has come down to like 9 months, right? Because the journey has just started shortening. And therefore, their ability to now look at health and start to buy more sophisticated products and services has gone up dramatically, right? So I think lack of consumer orientation, lack of technology orientation, very large market, now lots of awareness, I think is driving this big growth. And I think eventually people want convenience. People actually, want health to become more affordable, more accessible, more easy for them to use as end consumers. And I think a lot of us, as we think about the eHealth platform, that's what we're trying to do. The Midlife view is make it more accessible, make it more affordable, right? And then all of the rest sort of starts to follow.
Interesting. Prashant, what's your view?
No, I think 100% agree with your comments as well as what Ananth said. It's one of the largest sectors that still has the maximum number of pain points. It's not designed for the consumer. And I think, of course, consumer centricity is absolutely missing. Technology or leveraging the power to give a better experience to the consumer is missing. And on top of that, one thing that I'll add is the supply chains are pretty primitive. So it's one of those sectors where it's the perfect storm to create a big disruption, because you look at the Indian healthcare supply chain, the entire fragmentation of that. We have very, very tiny mom and pop components of the supply chain, as a result of which a lot of basic level sophistication has not creeped into this system. So whether it being simple things like track and trace of where your medicines are coming from, how they are being managed, how they are being stored, to having a decent enough inventory management system. We have, I think, as an ecosystem around, if I'm not mistaken, $30 to $40 billion is locked up in inventory across many parts. So I think customer centricity is missing. Technology based solutions are yet to be deployed. If you look at most healthcare services, I don't know if they even do a sophisticated analysis, but all over the world, the NPS is in the 20s or 10s. That's how bad healthcare services by design are. So I think that there's a lot of pain, and it's a large market, and it's a growing market, and it's not a market that is dependent too much on economic cycles. It's and as a country, all said and done, the direction is pretty clear, because once the per capita income goes above a certain level, that's where the healthcare spends actually grow exponentially. So I think we're hitting that as a country.
Right. Interesting. No, I think valid point. So I was just doing some back of the envelope calculation on the back of the reports. Of course, report is a lot more detailed, but as Abhishek just spoke about, we have 90 million households which are buying products online right now on an annualized basis. And out of that, when we did the survey with the customers, how many of them are willing to buy pharma or e-health related services, 60 million of them said that we would try. And then out of that, how many of them are actually buying? That's about 4.5 million. And that's where I see that the biggest drop is. While there's a willingness and a slight awareness, but the transition of the funnel from 60 million to 4 million is the biggest gap. And when we did the analysis and did the projections, one of the things which came out was, while the base of 90 will go to 180 million and maybe 60 will go to 140 million, the biggest jump is coming from the 4 million going to about 57 to 60 million. So people are trying out.